Hello, my name is Derek Jorgensen, and this presentation is on counseling patients who present to a community pharmacy to refill a prescription. By the end of this presentation, participants should be able to use a structured framework to counsel a patient regarding a refilled prescription. Now, this is a scenario that many of you, especially those in first year, may not have been in before as a patient if you don't take any chronic medications. So I'm going to take a moment to walk you through how this scenario typically occurs in our health system in Canada. So some people take regular prescription medications for chronic medical conditions on a daily, monthly, and chronic basis. And generally people only get between 1 and 3 months supply of their chronic prescription filled at a time. And this provides the pharmacist with an opportunity to follow up and monitor the patient on a regular basis to make sure everything's going all right. Remembering this is the last step in the patient care process to follow up and monitor. And this is how we do this in a community pharmacy with chronic medications. So patients who are taking chronic medications tend to come into the pharmacy once every 1 to 3 months, and they will ask the pharmacist to have their regular prescriptions renewed. And most times these prescriptions are ordered by phone, and then the pharmacist prepares the prescription and the patient comes to pick them up. So those of you with experience working in community pharmacies already may have observed that when patients come to pick up their refill prescription that they've ordered over the phone, that in some cases perhaps the cashier or the technician simply takes payment and no interaction occurs with the pharmacist at all, other than the cashier or the technician will likely ask the patient if they'd like to talk to the pharmacist. And probably in most cases the patient will say no, they don't need to talk to the pharmacist because they don't have any questions and they don't want to bother the pharmacist. So in my opinion, this doesn't represent optimal pharmacist care if the pharmacist never interacts with the patient when they fill up their chronic monthly medications. And if this is occurring, our pharmacists are missing out on a huge opportunity to improve care, since the whole point of refilling a prescription every 1 to 3 months is to have an opportunity to interact with the pharmacist to follow up and make sure everything's going well. So I had a student recently who had a part-time job in a community pharmacy that didn't typically on a regular basis counsel patients who were picking up their refill prescriptions, and the student asked their supervisor for permission to do this since she had the time. And she told me the first day that she did this, she found 2 significant issues that patients were having with their chronic prescriptions that, presumably they would have never caught if she wasn't counseling patients using the framework that I'm going to present in this short presentation. So realistically, most of the time, when you counsel patients who are picking up a refill prescription, you're going to find nothing wrong, and the patient will have no questions. But just think, if you catch 2 major problems a day, every day for an entire year, just think how much you've improved the care of the patients at your pharmacy. And in my opinion, I think this is worth the 3 to 4 minutes it will take to complete this counseling. So when we're counseling a patient about a refill prescription, there's 3 main goals that we're trying to achieve. You're looking to ensure effectiveness, safety and tolerability, and adherence. You want to make sure, is the drug still working for the chronic condition that it was meant? Is the patient tolerating the drug or experiencing any side effects? And has the patient been taking the medication as prescribed? So similar to the new prescription counseling session, I'm going to walk you through, in this case, a 4-step framework for how to complete this quick interaction in the subsequent part of this presentation. So as with new prescriptions, before you talk to the patient to hand out the refill, it's very useful to screen the patient profile on your pharmacy system, and in some cases the provincial electronic health viewer, looking for things such as, are they refilling the prescription on time? Is it too soon? Is it too late? And if it is, these are things you'll probably want to talk to the patient about when they come in. Were there any notes from the last time the pharmacist, or are there any notes from the pharmacist from the last time this prescription was refilled? And if there are, those may be things that you need to follow up with the patient. Now for certain drugs, there may be lab test results that you'd like to look up to assess if the drug is working or if it's safe. This isn't always going to be the case, but for example, if the person you're refilling a cholesterol medication, you might check the electronic health viewer to see if they've had any cholesterol tests done recently. And if they haven't, that's maybe something you want to talk to the patient about. Or if there are drugs that have common side effects that show up on lab tests, such as anemia for some drugs, you might check the electronic health viewer to screen for this side effect before you talk to the patient. Now in the second step, you meet with a patient to talk about their refilled medication. And step one is really the same as the new prescription scenario. You need to confirm the patient's name along with at least one additional secondary identifier. And in step two, it's also the same as the new prescription scenario, but probably even more important for refill encounters because it's going to be more common for patients to not be accustomed to being counseled with when they pick up their refill, especially if the pharmacy you're at hasn't been doing this in the past. So you might quickly say something simple, like the quote on this slide. I'd like to take a minute or two to chat with you about this refill prescription, just to update your profile, and also to make sure that this medication is still working optimally for you. Is that okay? And I think most patients will be fine with this and not decline the counseling. So next you ask the patient a few questions to gather any additional information that you could not get from the patient's profile and or the eHealth viewer to be able to assess that the medication is likely working and achieving the goals of therapy, that it's being tolerated, and that the patient is adherent. And here's a list of some of the common questions that you usually need to ask a patient to achieve these goals. Always a good approach to start off by asking the patient if he or she has had any troubles with the medication since they've last had it refilled, or if they have any questions or concerns since they last had it refilled. So even if you have the information on your computer patient profile in items 2 and 3 on this slide, it's very important to ensure that this information is up to date because these things can change quickly. So it's important to confirm for the patient what the indication of the medication is, unless of course it's very obvious, like a cholesterol medication that's only used to lower cholesterol. In that case you can probably skip confirming the indication with them. But certainly it's vital to update their patient profile by asking them if there were any changes to their prescription medications, any changes to their non-prescription, herbal or natural medications, or any new diagnoses or medical conditions. So it's not necessary to collect a specific list of their medications and medical conditions. In these cases, in my opinion, and in the lab, we only expect you to ask the patient if there have been any changes. So next you'll want to take a moment and ask one, maybe two questions to assess if the drug is working, if the patient's having any side effects and they're tolerating it, and if the patient is adherent to the medication. So some tips to assess if the drug is working using one or two questions. So remember, the goal here is to try to determine if the goals of therapy for the specific drug or condition are being met. And so some of the information you need to assess this will be different for each medication and each medical condition and for each patient. So it's difficult to tell you specifically what questions to ask. And until you learn more in therapeutics, this will be difficult, and we will provide you with the individual patient's goals of therapy when you're practicing this in the lab until you have more experience to do this on your own. So here's one example, going back to the cholesterol medication example. Presuming the goal of therapy was to lower the patient's cholesterol levels by 50% or more using this medication, you might ask the patient something like, have you had your cholesterol checked recently? And if so, do you know what the results were? Another example, say for an allergy medication where the goal was to improve their allergy symptoms to the extent that they weren't interfering with the student studying for exams. You may ask the patient, how have your allergies been this month? And are they interfering with your classes or studying anymore? So again, this is the technique of starting off with an open-ended question and then following up with a closed-ended question to collect all of the information that you will need. So what about asking a patient one or two questions about side effects? Typically, I would suggest you do use two questions to ask about side effects, and a good way to do this is to initially ask generally about side effects. So something like, have you noticed any side effects from this medication since you were last in the pharmacy? And this is because every drug can often have dozens of different side effects, so it's pretty difficult to specifically ask about all of them. And so using a general question like this initially is quite effective. And then I would suggest to follow that question up with asking specifically about one or two of the most common side effects for the drug being refilled, unless, of course, the patient already reported them in the first question. And so you might ask something like, have you had any problems with muscle aching or dizziness since you were last in the pharmacy? Now, this is useful because many people may be experiencing side effects like dizziness or muscle aches, yet they might not attribute that to their drugs. They might think the dizziness and the muscle aches is from their exercise routine at the gym or the fact that they're getting old. So if you only ask generally if they're experiencing any side effects, they might say no because they don't think these are drug side effects. And so it's still very useful to it's useful to ask specifically about common side effects. So with this two-question approach, you're most likely to catch the majority of the side effects that a patient might be experiencing. And for first-year students, until you learn more about therapeutics, we will provide you with the common side effects to ask when you're practicing this in the lab. But once you've learned about a drug and therapeutics, we'll expect you to do this on your own or to look this up before you do your counseling. And finally, some tips to how use one or two questions to assess adherence. Remembering from a previous presentation on comprehensive interviewing that patients may be reluctant to tell you if they're non-adherent. So I'd suggest using an open-ended question that doesn't lead them towards an answer and that's non-judgmental. Something like the examples on the good column of this slide. So I might often ask a patient, how often do you get up in the morning or get to the end of the day and realize that you didn't take some of your medications the day before or you didn't take your medications this day? Or you might ask, how often do you take a lower or a different dose of this medication or skip taking it altogether, trying to get at intentional non-adherence? And so usually I would ask both of these questions and hopefully catch as much adherence as possible. And of course, avoiding the bad examples on the left side of this slide, which are mostly leading or fairly judgmental ways to ask this question. So, what do you do when you find a problem related to ineffectiveness, poor tolerability, or poor adherence when you're counseling a patient on a refill prescription? Keep in mind, the vast majority of the time, everything's going to be fine, and you'll do nothing because you don't need to do anything, and you'll just give out the prescription. But, those one or two times a day when you do find something major, you'll need to be prepared to intervene and decide what to do when you find something. And what you'll need to do will be very different and unique in every scenario. And we will practice this in the lab. You will have scenarios where you're expected to identify a problem and decide what to do. And finally, you need to wrap up the counseling session, again, in an organized and logical fashion. So there are several things that you might do depending on the circumstances, although all of these may not always be applicable. Certainly, you're always going to want to encourage the patient to contact you if they have any problems or questions down the road or in the future before they pick up their next refill, which is the final bullet on this slide. And you certainly always want to finish off by asking if the patient has any additional or final questions. So the last two bullets on this slide I would suggest you should always do. Now the first few bullets are things that may or may not be applicable. You may decide to congratulate the patient for being adherent. For example, if you found on the eHealth viewer their cholesterol level was perfectly in target and they told you they take it every day, that's a good opportunity to encourage future adherence by congratulating them and making the link to how well their cholesterol is controlled, and it's because they've been adherent and that this is now likely significantly reducing their risk of a heart attack and a stroke. You may choose to remind the patient about any long-term side effects to watch for or important lab monitoring that needs to be done on a regular basis. And you may want to reinforce the long-term benefits of the drug. So in summary, I've shared for you a 4-step framework that you can use to counsel patients who present to a community pharmacy with a refill prescription request.